Hello, everyone. This is Lindsay Weitzel, PhD, migraine strategist, and medical migraine science writer. I am excited and honored today. I'm very excited. Actually, I'm here with Dr. Dawn Buse. She is a clinical professor of neurology, and she is also a psychologist who specializes in headaches. She has presented some very interesting data at the American Headache Society meeting this year that I'm really excited about and that I think is really pertinent to all of us who have migraines. The data was on how our migraines affect our relationships and our families. And I think we're all very curious about that. You know, we all have mommy guilt. We all wonder about these things. And she's been able to quantify some of it, and I can't wait to talk to her about it. So without delaying anymore, this is Dr. Dawn Buse. Hello.
Hi, Lindsay. Thank you so much for talking with me today about one of my favorite topics and the Cameo study and its findings.
Yeah, I'm so excited to have you here. So I think everyone listening would love to hear some background of what made you want to pursue this research on the effects of migraines on families and relationships.
Well, I'm actually a licensed clinical psychologist. I've worked with people with headache, pain, chronic illnesses, and disabilities for my entire career. Mm-hmm. And I was the director of behavioral medicine at the Montefiore Headache Center for the last 12 and a half years. So I got to talk with people one-on-one about the effect that migraine has on their life. Right. And I imagine that most people listening know this very well, better than I do, in fact. But I got to hear one-on-one about the debilitating effects migraine had on careers, on school, people dropping out of college, not able to finish, choosing not to start a new educational program, choosing not to accept a promotion, and also the big effects that that migraine has on relationships, including marital relationships or intimate personal relationships, as well as parenting relationships with kids. Right. And so I got to hear these stories one-on-one, you know, day in and day out, year in and year out. Well, every person is unique and every story would be different and situations would be different. The themes were the same. The theme being that migraine, especially as it gets more frequent, like chronic migraine or high frequency, really steals away important opportunities, important experiences, time with loved ones, and that this was really heartbreaking, frustrating, angering, upsetting to people. And so I wanted to share these stories, and in order to really make an impact on other organizations like physicians, scientific organizations, insurance companies, the NIH who funds research, we need big numbers and fancy analyses and solid scientific analyses that come from gathering data on a large scale. So I was working on the Cameo study, which is a chronic migraine epidemiology and outcome study, which is a study sponsored by Allergan. And it is a study that we collected multiple questionnaires every 3 months for about a year and a half from a very large sample of people with migraine. I'll give you some of the details in just a minute. Okay. And we were able to put in these questions, and I was so happy and excited that we could add these very important questions, which are so central to living as a human with a chronic illness, into this big, rigorous scientific study, so that we can say to these other organizations, be they, you know, the NIH, our insurance provider who we're trying to get coverage from, or our spouse, look, this is a really impactful disease. It's a big deal, and living with it is hard. Yeah. So I was so happy that we could actually quantify this in a large scale sample. Yes. So that the people who would tell me their stories one-on-one really kind of got to have their voices heard by the world.
Exactly. Yeah, I just to put a personal note on it, I don't know how much you know about my personal migraine history, but I had a migraine essentially every day, chronic daily migraine from the age of 4 to the age of 30. I got married when I was young, 21. And I've recently, in fact, I signed my divorce papers last week. And yes, a lot of it has to do with the impact of the illness on my relationship. Little backwards to some people's stories, perhaps, because I was horribly sick and got significantly better and was a different person, and my ex-husband and I could no longer relate to each other. So the impact that this illness has on relationships and families is huge. There's no way around it. And being able to quantify that so that we can explain it to the rest of the world is hugely important. So I'm so glad you did this work. So let's get to talking about it. Can you tell us, was there any more you needed to tell us about the Cameo study itself?
We asked about all the big areas of life. How is migraine affecting your relationship, whether you're married or cohabitating or in an intimate relationship, dating, or if you're single? How has it affected being single? How has it affected your past relationships? And then we also asked for the people who have kids, how does it affect life with children? How does it affect things like emotional feelings about yourself as a parent, yourself as a mom, as a dad? How does it affect things like daily chores, taking kids to school, getting them there on time, helping with homework, making dinner, doing laundry? And if you can't do those sorts of things, who helps? Does anyone help? How do you feel about asking for help? How do others feel about giving you help? We went there. We asked all these kinds of questions. Not only did we send surveys to people with migraine, but we sent surveys to their spouses, if they gave us permission, and their kids, basically their teenagers. So we know teenagers have a lot to say. So we asked their teenagers, what's it like having a parent with migraine?
How many of the participants were female versus male, and how old were they?
So in migraine research, when we do epidemiologic research, we try to match what the world looks like in terms of people with migraine. So just like the US with migraine, we have about 2/3 of them, and actually closer to 80% in some cases, were female.
Okay.
So that kind of represents what the world looks like, with about 75% of people with migraine being female and 25% being male, depending on what age we're looking at. But in midlife, it's about 3 times more common for a woman to have migraine than a man. And then the average age is in the low 40s, which again is kind of the average of people in the US with migraine, although we know that migraine can start in childhood. It really ramps up in adolescence, especially for females, and then is most prevalent in the 20s, 30s, and 40s, which is of course the time when we as women are the busiest with career and family, maybe little kids, maybe aging parents, juggling all of that, and that's when migraine is most common. So it is a sample that is representative of the US, and we match several demographics. We try to look like the census in gender, age, race, ethnicity, regions of the country. So this is all across the US, and other sociodemographics. So it's a very representative sample. So we can say that it's a pretty good report of what life is like with migraine.
All right. Well, one of the most interesting points to me as I looked at your data was that all the results, all of the significant things you looked at as far as impact of migraine on relationships and families, definitely, I don't think there was a single one that wasn't more significant in chronic migraine than episodic migraine. So I was wondering if you could comment on some of that data.
Right. And that's certainly not surprising. Every question we ask, pretty much across the board, is more impactful for people who have more frequent migraine. Chronic migraine is certainly more impactful because probably someone is having headache at least every other day, more days than not, maybe even every day. And so when you compare that to a high frequency episodic migraine, so maybe somewhere between 10 and 14 headache days a month, which is still a lot, or a low frequency episodic migraine, maybe less than 4 headache days in a month, you're going to have more impact with chronic migraine. And then not surprisingly, you have more negative impact on your life, your job, your time with your kids. You have more vacations canceled, you have more guilt and resentment with your spouse. All these emotions are heightened too, because when there's more impact, you're going to have more emotion. So as you said, across the board, as headache day frequency increases from the lowest frequency episodic up to the high frequency episodic up to the chronic, the impact of migraine gets worse and worse.
Yeah. I wanted to read a little bit of the data, if you don't mind, just because I think people will find it interesting. So 17% of the people in the study reported that headaches had been a problem or had contributed to a relationship ending. 18% reported that the headaches prevented a closer relationship with their partner, and that was more significant with people with chronic migraine, as we said. 3% of them indicated that they delayed having children or had fewer children because of their headaches, which is, I see this with the people that I meet with that are my clients all the time. One of the main questions they ask is, am I ever going to have a baby? Like, get me to the point where I can go off of enough medications to have a baby. Which medications can I, it's one of the biggest questions on their mind, and it's really sad.
It is. And I don't know how much people who don't live with migraine realize that.
Yeah.
I don't know how much people who don't live with migraine realize these long, far-reaching, major life decisions are impacted by having migraine. And so this would come up in my practice all the time with women saying, as you said, I need to get off medications to get pregnant, but I don't feel like my headache is stable enough to do that, or my migraine is stable enough, or becoming pregnant as a surprise, which we know that more than half of pregnancies in the U.S. are unplanned, just not necessarily trying, but they just happen. And then being very worried about what do we do about the medications we're currently on. Right. And then also asking about, can I be a mom? Can I parent? Can I be there? Can I give time to an infant who needs me 24 hours around the clock? Do I have a spouse who could really, or a partner who wants to step in as much as I might need that? Can I be a good parent to a young child? Can I be a good parent to an older child? Can I coach their soccer team? Can I help with homework? Can I take them to the beach where it's hot and sunny, or a movie theater where it's loud and there's, moving images that might create vertigo?
Or
so
the noise of children.
Mm-hmm.
That's something people bring up all the time. It's very anxiety provoking for people.
I think of all the findings of this study, this was one of the most heartbreaking. Not surprising. You and I hear it, and I'm thinking that our listeners are going to connect and understand what we're saying. Mm-hmm. But I think to people who don't live with migraine or live with a loved one with migraine, this is surprising that people would make such a huge life choice based on migraine. And so you've mentioned about 3% on average said that because of migraine, they either had fewer children, delayed having children, or decided not to have children at all. Mm-hmm. And it's actually close to 10% of the people with chronic migraine who said that.
I waited 14 years after being married to have children for this entirely because of the migraines. So I was 35 when I had my first kid and 37 when I had my second. And it was all because I was just waiting to hopefully someday feel like I was well enough to have a child. So yes, it's a huge problem, huge. So I also wanted to throw out a couple more data points. It says that 50% believed they'd be a better partner without their headaches. And that was actually 78% once you were in the chronic migraine population. And 39% of respondents agreed they would be a better parent without their headaches. And it was significantly more in the chronic migraine population.
Yeah, I think it's about 75% of those with chronic migraine said I'd be a better parent if I didn't have headaches. Living with migraine is so all-encompassing. And if you are part of a family or part of a friend network, also part of your workplace, the more people you can have understand what you're going through, what to expect, and what your treatment plan is, the better. Mm-hmm. And so bringing with you to a doctor's appointment a loved one, whether it's a spouse, whether it's your teenager, whether it's a close friend who you end up maybe canceling with sometimes and who was getting resentful or who didn't understand, or even sharing a note from your doctor's appointment with your boss or your HR department saying, here's my diagnosis, here's my treatment plan, and here's how you can help me best care for myself so I can be the best part of either best coworker I can be, or the best parent I could be, or the best spouse I could be.
Yeah.
And so a lot of the treatment planning for migraine care, as we know, includes not only getting on the right medications and optimizing that, but doing very good lifestyle self-care. So having a good sleep-wake schedule, getting enough sleep, trying to get exercise or at least moving, staying hydrated and eating well, and managing stress. And so I like for our spouses, our teenagers, our kids, our family members, our bosses to know those are actually part of our treatment plans. That's not a nice little wish list, okay, maybe we can do that. That is step one. To live well with migraine, we have to balance the nervous system, keep everything calm and regular. And the way we do that is by keeping these healthy habits. So the more that we can keep these healthy habits, we might be able to reduce our frequency of attacks or our intensity and severity of attacks, which again makes us a better parent, a better spouse, a better coworker. So they can actually help by supporting all of these things you want to do. So for example, if mom needs to start managing her stress better, then maybe she gets to go out to yoga 2 nights a week with a friend, and dad's going to make dinner those 2 nights of the week. Or maybe our teenagers are going to do the dishes, and mom and dad are going to go take a walk every night after dinner, 1, to get some exercise, and 2, to manage stress. So bringing in family members or members of your support community, and whoever they may be, is really important to the success of your treatment plan. If they know this is not just a nice what if, but this is something your doctor has advised you to do,
Right.
they can help you make time for it. And they may also need to do a little adjustment in their schedule and their expectations to support you in having successful treatment outcomes. People want to help. They really want to help, and they just don't know what to do.
Right.
And so people with migraine want to, 1, let people know how they can help, and 2, accept the help. A lot of times people are so strong and we're really trying to hold it together and trying not to let anyone down or disappoint anyone or drop the ball, that everyone's kind of being brave and they don't accept help. And I'm saying, accept the help. Not only will it help you, it makes other people feel better. They feel like they're doing something.
Right.
This may be your 3-year-old. I have a 3-year-old. This may be your 3-year-old who mommy goes and lays down in a dark, quiet room. You take your medicine. Your 3-year-old says, "Mommy, are you okay?" And you say, "You know, honey, if you can bring me a cold washcloth, that'll make me feel better. And then if you can play quietly in the other room while I sleep for a little bit, that will help too." Now you've given your 3-year-old something he or she can do, which feels very empowering, instead of feeling very scared of watching a parent being sick and debilitated.
Right.
Now they've got a way they can help. So from your child to your spouse to your coworkers to your boss, if you can give them all action items of how they can be helpful, they feel empowered, and now you're on the same team. Instead of this disease dividing and isolating the person with migraine and leaving the other person who cares about you feeling very helpless.
Right. No,
So
that's
in the workplace, you can think about things like, you can say, is there a dark, quiet place that I can go when I need to rest for a little bit? I may be able to take my medicine and rest instead of going home for the whole day. If I have a place I can nap for an hour, I might be actually able to feel better. So giving even things that can be done in the workplace, you know, can I get out from under these fluorescent lights? Can I wear my sunglasses at work? Maybe even choosing a lovely, you know, rose tinted or yellow tinted glass that's acceptable. And anytime you need help backing you up, your healthcare professional is happy to back you up. We will write notes to any of those things. And you are protected in the workplace and at school, according to the Americans with Disabilities Act, for fair accommodations, reasonable accommodations. And those are things like getting a break to eat. If lights are a trigger for you, getting out from under harsh light, taking your breaks, all of those sorts of things. So, so take advantage of what is fair and right for you.
So that goes into my next question, was if you have any personal advice for those of us with migraine on dealing with our relationships, our marriages, or our children, being parents.
Absolutely. So we talked about good communication, being open and sharing what you're going through and what your needs are. So that's a good place to start. Having plans in place, whether it is getting your kids ready for school and doing it the night before, having all their backpacks out and their lunches ready, or having a backup plan, knowing who is a friend that doesn't mind picking them up from school, or a family member who could help out with the homework or take them, to the basketball practice. Having a plan B in place that you don't feel guilty about might reduce some anxiety and worry about the next attack.
Right.
We call that in our research interictal anxiety. So ictus is the migraine. And not only do we have worry during the migraine, but we actually have more worry in between, wondering when is the next one going to come? What's it going to ruin?
Right.
Think about going to a holiday party. The holidays are coming up and you're thinking, I'm not going to RSVP because what if I can't make it? And now she's made extra food and bought extra things, and what if I can't make it? Well, I want to say to everyone listening, don't wait to live your life. Just live your life now. Don't wait. And friends and family can adjust and understand. I would tell that hostess, I have migraine, and if I have an attack, is it okay if I cancel? If I need to leave early, would that throw off your plans? Give the person the opportunity to say yes. If they say yes, say, I understand. Thank you for telling me. I think 99 times out of 100, they're going to say, no, come anyway. Come if you can. If you can't, I understand. I was working with someone who had RSVP'd no to his granddaughter's graduation lunch because he didn't want his daughter to pay for a lunch in case he couldn't be there.
Yeah.
And missing out on these important, sweet, special life events is not the right thing to do, because as we do that, we become more isolated, more depressed, more anxious, more guilty, and all of our relationships suffer. People who love you and care about you want you around. Give it your best shot and let them know there might be a plan B.
Right.
Think about plan Bs and bigger things too. I would find a lot of people would not plan a family vacation to a destination that might be like a hot beach or a cruise you can't get off of, or a loud, crowded place like Disney World. But, talk to a partner in advance, or if you're single, bring a friend and make sure that friend is comfortable if she needs to take your kids for a bit. Find another thing they can do. Can they go to the pool right next to you instead of going all the way out to the beach while you relax and take a nap? Or is there babysitting on site or locally? As we start to go through solutions, there are often so many solutions we didn't even think about that we can make accommodations rather than just not participating.
Right.
And so this is so important to our relationships with our spouse and our relationships with our children, that we keep trying to be present. Yes. And when we're not, they understand. And it's a little bit of a lesson in adjusting expectations. So life is not perfect, and it's not always going to be perfect. And it's okay for our children to learn that. Right. Interestingly, I find that children and spouses are nowhere near as hard on the person with migraine as the person is with migraine on herself or himself. That their judgment is not as harsh, and that they are generally more understanding.
Yes. We are all so hard on ourselves. I mean, because you have, even healthy people have mommy guilt.
Oh, sure.
And
when we say healthy people, I don't know how many adults don't have something.
Right.
We all kind of live with something, whether it's medical or emotional or financial or life circumstances. I think we all just kind of keep it inside and try to present our best selves, and often don't share what's going on. But it's interesting, once you kind of share a vulnerability with a friend, or sometimes a coworker or a family member, how most people in life are going through something.
Right.
A lot of times what will happen is, for people who are losing a lot of their life to migraine attacks, when you're not feeling in pain, you think, okay, now I have to do these chores, I have to pay my bills, I have to do all these things. So you get to kind of the work. Yeah. And I would say make sure you take some of that time and also get to the good stuff. Spend some time focusing on your partner. Ask him or her how they're doing and listen to what's going on in their life for a while, or do something special for them. They've probably helped you during an attack. Maybe they took the kids, maybe they made dinner. So as soon as you're feeling well enough, go make their favorite dinner, or go get takeout. It can be easy. Watch their favorite movie on TV with them. Just make sure that, watch Netflix of their favorite show. Just make sure that they get a little bit of time feeling special, and make sure that your relationship doesn't become a patient caregiver dynamic, because that's not fun or sexy. We want to kind of remember kind of our mojo and why we love our partner, and try and keep some of that, even if it is a different level from what it might have been in the beginning. That's okay. Just try to keep that connection.
That's great advice.
And so in summary, I would say, please don't wait to live your life. I know that the life you're living right now is probably not the way you envisioned it when you were a child, and you have some limitations, and you've made choices that you needed to get by, that were dictated by the disease. But even though it may not be the way you envisioned it, it can still be good, and it can still be sweet, and it can still be a great life.
Right.
And we have to just adjust expectations to really focus on the good that we have. And also keep thinking about what else we can do to be our healthiest and be our happiest. There's new pharmacologic treatments. There are always the great behavioral treatments, the CBT, biofeedback, meditation, and stress management, and always thinking about the lifestyle things which are so important to keep ourselves healthy, because we need to be at our healthiest and our best to care for the people we love, like our children and our family.
So true.
Yeah.
Very true.
And if stress, depression, or anxiety are feeling overwhelming, please reach out for help. As I mentioned, I'm a health psychologist, and people like me are sitting there across the country will want to talk to you. Generally, it should be covered by insurance, and there are people who are trained to talk about these exact factors that we've just talked about just now. So please don't be embarrassed or shy to reach out for help, because we're there and we'd like to help.
So thank you so much, Dr. Buse. That was amazing. I think that everyone is going to benefit from that interview and from your data. So I just want to thank you for studying that and reporting that. And the world is a better place for you having done that.
Thank you. And if people are looking for resources about how to find a health psychologist or a headache specialist, I have links on my website to the scientific organizations. So you can find biofeedback, find cognitive behavioral therapy, and it's just my name, Dawn Buse, DAWNBUSE.com. And I also have mindful meditations and guided visual imageries on my website as well, if you'd like to try those to relax.
All right. Well, thank you so much. And this is Dr. Buse and Dr. Weitzel signing out. Everyone have a wonderful and as pain-free a day as possible.